In this discussion, we are going to talk about alcohol abuse and the influence, the history, the prevalence, risk factors, side effects, suicide potential, as well as overdose, interventions such as psychopharmacological interventions, as well as non-psychopharmacological interventions, education, and referrals. As mentioned before, we will be discussing the topic of alcohol, including its history, its occurrence, risk factors, as well as vulnerable population, the effects of drinking alcohol, signs and symptoms of somebody who is intoxicated, and interventions. As we all know, alcohol has been around for quite some time and it expands back to thousands of years, um, encompassing a range of culture, civilization, dating back to prehistoric times, back to 10,000 BC, the ancient civilization. According to the DSM-5, 29% of the United States um, has been diagnosed with alcohol use disorder. Its prevalence is majority dominantly in men and also in African American, non-Hispanics, and whites. Potential risk factors for alcohol substance use disorder includes male, low income and poverty, those who have experienced discrimination, those who are unemployed, um, a high stressful job life due to work, external factors, health, also access to alcohol and experience with alcohol, and those with family history of alcohol abuse are 3 to 4 times more likely to be predisposed to alcohol. Side effects noticed on patients who are intoxicated include nystagmus, inability to focus, maintain conversation, slurred speech, impaired speech, lack of coordination, impaired gait. It can be as extreme or severe as coma, and mood changes are noticed. Although dying from alcohol intoxication is not as common, the use and abuse of alcohol can lead to other complications that can cause death, such as DUI, drinking under the influence, worsening depressions. Those who already have depression may heighten their thoughts and increase suicidal ideation and commit actual suicide. Organ damage, which can cause other medical conditions to further decompensate the patient and die. Withdrawal complications as well. If a patient is going through severe withdrawal, the body physically responds, can cause patient to go under cardiac arrest, as well as damages to the brain. When it comes to caring for a patient with alcohol abuse disorder, one must consider potential options, which include detoxification, medication, behavioral therapies such as life modification, support groups, and counseling. Some of the options for medications include disulfiram, naltrexone, acamprosate, diazepam, and chlordiazepoxide. A lot of these medications, such as diazepam, are used during withdrawal moments and to help with reduce withdrawal symptoms, while medications such as disulfiram kind of help the body have a allergic reaction response when. Other methods used to treat alcohol use disorder include Alcoholics Anonymous, support groups, psychotherapy, cognitive behavioral, and a sobriety sponsor. Patients who are willing to better themselves can reach and receive support from Alcoholics Anonymous, sharing emotions and feelings of crave helps when gathered around a group of people, as well as support groups. Psychotherapy, which can include cognitive behavioral therapies, finding different ways of coping in an effective and a positive manner, and a sponsor who can help you during times of challenging. When it comes to patient education, one must understand that important component of treatment and is the desire to get better. Um, the patient has to be willing and wanting to better themselves, as a lot of these modifications and changes are driven by the patient taking the medication as taking the medication often, finding ways to avoid alcohol, relying on support group, and being vigilant. In the event that the patient does not feel that they're capable, there are other alternatives and options such as um, a rehabilitation. Patients will be educated on emergency contact information, effects of alcohol in the body and systems, and how the alcohol can change brain functions and create that instant gratification. Referrals would include one directly to the primary care physician. Labs would need to be obtained to monitor electrolytes, see damages to liver, kidneys, and see how the body has been reacting to the overconsumption of alcohol. A rehabilitation center is another option if patient is having difficulty with self-control, and of course psychotherapy services. In conclusion, alcohol is something that can impact a person's life in many aspects, not only physically, mentally, but also in relationship and career, as well as